Hello, everyone, and welcome to our one-on-one discussion today with the scientists within the Miami Project to Cure Paralysis. Today, we have the pleasure of speaking with Dr. Jae Lee. Jae is an associate professor in the Department of Neurological Surgery and an extremely important member of the Miami Project. My name is Dalton, Dietrich, and I'm the scientific director of the project. Today, I get to ask the questions, and Jae's going to give us some really great answers about what he's doing in the area of spinal cord injury. So thank you for joining us, Jae. You have a fantastic laboratory program interested in targeting spinal cord injury and recovery of function, specifically looking at wound healing and injury after spinal cord injury, and how this can actually impede successful regeneration and therefore recovery. So can you tell us a little bit about wound healing in the context of spinal cord injury?
Sure, Dalton. Thanks for inviting me and giving me this opportunity to introduce my work to everybody. So to answer your question, the wound healing process in general consists of several processes that occur over time. It starts with inflammation, followed by cell proliferation, and then by tissue remodeling. Interestingly, these processes in wound healing are similar across many different organs, including spinal cord, liver, and even skin. And just as the name implies, these processes are meant to repair and heal the injury sites. What's unique in spinal cord injury is that there are two wound healing processes that occur in parallel. One is by the glial cells that make the spinal cord, such as astrocytes and microglia. This wound healing process is commonly referred to as gliosis. And the other is by non-neural cells, such as macrophages and fibroblasts that come in from outside the spinal cord, and this process is commonly referred to as fibrosis. So that's kind of what wound healing is after spinal cord injury. You can kind of think of it as wound healing on your skin, and that visualization is actually a pretty accurate depiction in general of what goes on in your spinal cord.
And that wound healing, of course, is there for good reasons and maybe some bad reasons. For good reasons, you kind of want to separate, the injured tissue from the normal tissue. But at the same time, as that injury forms and that scar forms, then your research and other researchers in the field are showing that these cells can actually release factors that impede successful regeneration.
You got it. You got it. That's just what happens there. Yeah, they have both beneficial and detrimental effects. And I use skin wound healing as because many people are aware of that, and they've seen that, as opposed to, for example, liver wound healing, where you can't really see, right? And so in skin wound healing, if you have a scar at the end, nobody wants the scar. But the kind of flip side of the coin is what happens if you don't have that scar. Well, you have an open wound, much like people who suffer from diabetes have, and that actually has a lot more complications and many more detrimental effects than you can have with a cosmetic scar, for example. And that scar is, like you said, non-functioning tissue. So this is the challenge that we're dealing with here.
Now, do all spinal cord injuries have the same amount of scarring? Does it vary in terms of severity or location up and down the spinal cord?
Absolutely. The scarring is a graded response. And so in animal models that we typically use, we're very consistent with the injury type that we produce. And so in animal models, it's more homogeneous. We have a very stereotypic quote-unquote scar that forms, and when we can vary that in the amount by varying the injury severity, the injury type. For example, if you have a contusive injury versus a surgical lesion injury or penetrating injury, they produce very different types of scars and wound healing process. But in general, like you said, the neural cells are trying to minimize the damage by surrounding the non-neural cells from spreading throughout the tissue. And then that creates this unique parallel process of a gliotic scar and a fibrotic scar.
Now, there's the temporal profile of laying down the scar. Does that is that an important concept in terms of therapeutic interventions? In other words, if it takes time for this inhibitory factors to be produced and released, and cells, invading cells actually help to contribute to this scar formation, can we still think about therapeutic interventions following the scar formation? And I know your lab is looking at that very intensely.
Right. So nobody wants a scar, right? And that's true whether you have a scar on your skin or scar on your spinal cord. And so previous studies have basically try to address this, but let's get rid of the scar, right? It seems very simple. And so you can do that by getting rid of the scar, rid of the cells that lead to scar formation.
Mm-hmm.
And pretty much every time people have tried to do this, the pathology has gotten worse. And so the field right now has kind of accepted the fact that the scar has a protective role, and that this protective role really outweighs the negative role it has on cellular regeneration. And so for therapeutic purposes, this poses quite a challenge, because this is the biology that occurs naturally, right? This scar formation and this wound healing process. And so how do we therapeutically intervene in this naturally occurring biology that's supposed to be protective? And so the challenge now is really to minimize this end product, the byproduct of wound healing, which we typically call the scar. So how do we, and so if you think about really the optimal wound healing process, it's to heal the wound without minimizing scar formation. And so this happens on certain tissues in your body. For example, if you get a cut in your tongue, you'd never get a scar, right? And this is true whether it's a baby or adult. And this is and even in development, if you get a cut in your skin as a child, it heals correctly. By healing, we mean that you regain functional tissue, right? But if you get that same cut as an adult, it heals into a scar, which is non-functional tissue, right? And so if we have a spinal cord injury, really the goal is to promote wound healing while minimizing the scar tissue and maximizing recovery of functional tissue. And so how do we get to this? So we've been trying to understand the biology of this process for the last 10 years. And there are several really important players that contribute to the wound healing process. One that we've been focusing on are immune cells that are derived from the peripheral immune cells, namely macrophages. So these cells differentiate from the monocytes that are traveling in your blood. And we've known for a long time that macrophages have both regenerative and inflammatory functions. And so as a field, we've been really trying to understand the mechanism by which this occurs and trying to tap into that mechanism to make them more pro-regenerative, and less pro-inflammatory. And what's nice about targeting macrophages is that they're derived from cells from your blood. And so if you think about giving drugs to a patient, cells that are in your blood are much more accessible than cells that are in your spinal cord. And so this has many therapeutic advantages from practical standpoint of trying to promote a more regenerative response. And so you can think of these macrophages as we're trying to use them as like a Trojan horse. They have this natural tendency to hone in to the injury site. And so if we just take advantage of their natural tendency to do this, and then we kind of manipulate them, modulate them into a more pro-regenerative state, then they can go to the injury site and then play a more pro-regenerative role for regenerating cells and as well as axons for regeneration.
Very interesting. It's just as we get deeper and deeper into the biology of spinal cord injury, the concepts become much more complicated. But at the same time, we're enlightened by the way we could actually manipulate the natural progression of in this case, the inflammatory and reparative strategies to actually promote repair. So that's why your research that's basic and translational in nature, one day it's going to help us move into the clinic, and really appreciate all of your work. Now you're at home, I'm at home, because we're right in the middle of a pandemic. And so because of the need for physical distancing, we're having to continue our research remotely. And earlier today, your graduate student just gave a spectacular talk. I mean, the images, the data were so interesting. We learned so much. So how is your lab carrying out research at a time when we have these barriers in front of ourselves in terms of to promote our research programs?
Fortunately, we've been at a point, we reached a point where we've accumulated a lot of data, and many of the people are now trying to publish their findings. So we haven't lost a beat, skipped a beat in our productivity. So a lot of our students are home writing up these research papers. But fortunately, University of Miami was kind enough not to completely shut down the university. And so we've been able to carry out some critical research pertaining to finding cures for spinal cord injury repair. And so, we've been very fortunate to have an environment where we haven't been completely shut down.
I think that's a really interesting concept to give our viewers, that basic, and people listening to this conversation, is that yes, we're in a pandemic. Yes, it's really worrisome times, but at the same time, scientists are so dedicated to their research. We can continue it, and we had our lab meeting today by Zoom meeting, and so we had 20 people talking, and basically they're doing the same thing you're talking about, writing papers, but reading the literature, coming up with new ideas, new concepts, so that when we do get back in the laboratories full time, we're gonna hit the road running, or whatever the phrase is. So anyway, thank you so very much for this nice talk. I think the project is extremely suited for trying to translate these new discoveries to the clinic, and we look forward to developing even new therapeutic interventions that we can work together, Jay and all of us, in terms of moving it to patient care. So thank you very much for participating. Really enjoyed it.
Thanks all. Thank you.